Okay, so today, myself, Kayla, and Natalie will be talking to you about phantom limb pain. So, phantom limb pain is the sensation and pain of a limb that is not there. This can either occur when a limb is not there from birth, but more likely occurs after an amputation. So, next is why does this occur? So, why does the brain perceive a limb that is no longer there? Well, during an amputation, when the nerves are cut off, those nerve endings become thickened and those send increased stimulus up to the brain. And it goes to the section of the cortical homunculus, which we have talked about previously in this class, that was associated with the amputated limb. That area is still functioning, so it perceives that something is wrong with that limb from the signals that are sent there, and it's not really sure quite what's going on, so it perceives as pain. So basically, we get pain from a limb that's no longer present because the brain senses that something's not right and is just kind of confused, and therefore we have pain. We have a little video that kind of shows this a little bit better.
Fully understand phantom limbs and phantom pain, we have to consider the entire pathway from limb to brain. Our limbs are full of sensory neurons responsible for everything from the textures we feel with our fingertips to our understanding of where our bodies are in space. Neural pathways carry this sensory input through the spinal cord and up to the brain. Since so much of this path lies outside the limb itself, most of it remains behind after an amputation. But the loss of a limb alters the way signals travel at every step of the pathway. At the site of an amputation, severed nerve endings can thicken and become more sensitive, transmitting distress signals even in response to mild pressure. Under normal circumstances, these signals would be curtailed in the dorsal horn of the spinal cord. For reasons we don't fully understand, after an amputation, there is a loss of this inhibitory control in the dorsal horn, and signals can intensify. Once they pass through the spinal cord, sensory signals reach the brain. There, the somatosensory cortex processes them. The entire body is mapped in this cortex.
So some symptoms of this is feeling pain. A lot of times people have described the pain as stabbing, shooting, piercing, or burning. Bruce Tompkins, who was a guy who had a below-knee amputation, described it as having your foot being in a bucket of water with piranhas in it or hot coals. He said, it gets so debilitating, I've actually huddled into a corner and just cried myself to sleep because it just won't go away. A lot of times I have always thought that amputation just fixes everything and you go on with your everyday life, but it doesn't. A lot of times it can cause more problems because how do you treat pain in a limb that's no longer there? So if you go to the doctor, a lot of times they'll ask when it started and the history of the amputation, why it was amputated, and then a lot of times the pain that you're feeling in that amputated limb is pain that was similar to when you had the limb before. So if you had a ton of pain leading up to having it amputated, a lot of times that pain will still continue to go on. Some treatment, I've heard some people will take, if my left foot was amputated, they have pain in it, they would take their right foot and massage it, and a lot of times that'll help because I've heard before that the brain doesn't really differentiate between the two. One guy said that helped him. Other times it's just treatment to try to figure out how to get the brain to trick itself into treating it in its own way. Sometimes meds are used, sometimes not, but Natalie explained that more.
So the main prognosis for this type of patient would be relieving their chronic pain because that's the main symptom that they're feeling. Some options for the treatment, the most common would be pain medications. Those include over-the-counter painkillers, antidepressants, anticonvulsants, narcotics, NMDA receptor antagonists. The antidepressants and anticonvulsants, those work kind of differently, and I never really thought of those as a pain reliever. But the antidepressants actually work to inhibit the damaged nerve endings from sending those pain signals to the brain. The anticonvulsants work to inhibit overactive nerve signals. And if the pain medications aren't quite enough, usually the pain medications and the non-medicative therapies are paired together for the patient. And the non-medicative therapies include physical therapy, acupuncture, mirror box therapy, virtual reality therapy, massage, and using a shrinker sleeve or sock. Some of the more basic non-medicative therapies would be the physical therapy, acupuncture, massage, and shrinker sock. So we're going to go more into detail on the mirror box therapy and virtual reality therapy later in the slides. If these two different kinds of treatment aren't working for the patient because the pain is much more severe, then surgery would be one of the options for them, and the main type of surgery is deep brain stimulation. This is from the Mayo Clinic website, which gives just a lot of information on phantom limb pain in general and a lot of different treatments that can be an option for the patient if you ever want to check that out. So more in depth on the pain medications, we talked about the antidepressants, anticonvulsants, but the NMDA receptor agonists actually work differently. They actually function directly on the central nervous system, and they block the area in the central nervous system that is processing those pain signals sent from the periphery. And they also work to block glutamate, which is a necessary molecule for making new pain signals.
So some of the more non-medicated therapies are mirror box therapy. That is where, say, my left hand was amputated. I would put the stump behind a mirror so that all I see is my right hand in the mirror, so then the brain kind of associates that with my left hand, and it can see that it's all right, and it'll go, okay, we're good, and then the pain can decrease that way sometimes. Another way is visual reality therapy. Tricks the brain, you're in a different reality where you still have your limb. And then the brain understands that things are going okay, we're good, and then the pain can decrease from there.
If any of the other things don't work, the next option is surgery, and most often a brain stimulation. And so in this, it sends electrical pulses, so there's a pulse generator and then like a wire going up to the head, which then has an electrode going into the brain. And this sends electrical impulses into the brain, which actually try to inhibit the signals that are then perceived as a pain. So this works to inhibit the pain of the affected limb. And then these are the resources that we used in writing our paper and for this presentation. So I hope that you were able to learn some new things about phantom limb pain and have enjoyed this presentation.